Hi, I'm Dr. Beth McDougall. I've been a medical doctor for 22 years in Mill Valley, California, and today I'm talking about long haulers or post-COVID syndrome. So I've had a few patients with post-COVID, and I've actually had some luck with them, and they tend to talk to one another on chat forums, and so I'm actually collecting now more and more. And as an integrative doctor, this scenario with post-viral syndrome is not terribly different than things I've seen throughout my whole career. And it actually has some features that are really similar to what I see in multi-infectious disease and chronic fatigue syndrome. So what I've noticed is that we need to think very holistically about these people, kind of outside of the box. I can give you a couple patient anecdotes. For example, I saw a woman who was 79 that I'd known before, and she actually was a very youthful 79. She seemed a lot more like 60. She had a really active life, very busy with her family, traveled a lot, and when she got COVID, at first it didn't seem like any big deal. She had a pretty uneventful, not very serious infection, and seemed to get over it within about a week. But then, progressively, her body became very inflamed. She ended up finding that any joints that used to hurt her a little bit in the past became incredibly sore and painful, and her muscles started hurting. She was having pain in her neck, her shoulders, her knees, and just kind of body-wide inflammation, and it began to really scare her. And from this constant pain, she was very on edge and actually developed a bit of anxiety. And then it started affecting her sleep at night. So she literally was having to sleep in a recliner chair because any position in bed was too uncomfortable. And so then her sleep was poor, and this became like compounded on the underlying situation. It was like a snowball heading in a really bad direction. So anyway, what I did is originally balanced her hormones, because our adrenal hormones and even the ovarian steroid hormones all have some anti-inflammatory properties, and I figured that her adrenals were taxed by the stress she was under and by this kind of body-wide inflammation and now the lack of sleep. So I balanced her adrenal hormones, and that took the edge off a little bit, made a dent in the situation. And I also put her on some proteolytic enzymes that are known to chew up fibrin in the bloodstream and kind of excess inflammatory intermediates and things like that. And that also helped to a degree. At this point, I was also measuring her inflammatory markers in her blood, and they were through the roof. And I thought, how bizarre, that she's really got this active inflammation. And I screened her for a whole variety of autoimmune conditions like rheumatoid and lupus and HLA-B27, and they were all negative, thankfully. And so then I thought, wow, maybe there must be an infection driving this. So I screened her for reactivation of some of the viruses that we have all come in contact with in the herpes family, like Epstein-Barr, HHV6, and CMV. Most of us are exposed to these before we graduate from high school. And if our immune system is healthy, we keep them dormant. We keep them under wraps. They never fully go away, but they exist in a dormant state in our body. And then if we have a major stressor that imbalances our immune system, these viruses can reactivate. So I drew titers for these viruses, and they were incredibly high in her. So unusually high, that really represented evidence for reactivation of these viruses. So it appeared that these viruses were now circulating in her system. So interesting, thinking outside the box, the COVID, the SARS-CoV-2 virus stressed her system to the point that it imbalanced her immune system, and her immune system lost its grip on these other viruses. So I put her on an antiviral drug called acyclovir, which by the way has no activity against SARS-CoV-2, but it does have minor, mild, not even great activity against these herpes family viruses. And lo and behold, she felt so much better. Now, she wasn't all the way better. So I went on a deeper dive hunt for other pathogens that could have emerged in the stress of the SARS-CoV-2 infection. And sure enough, I did find a pathogen that can be communicated by a tick, sometimes by fleas, and it's called Babesia. So Babesia is a parasite that lives in the red blood cells, and it's very similar to malaria. So I put her on some herbs for Babesia, and they began to help. And then I thought about it, and I thought, there is a medication that's been shown to be very helpful for Babesia that is also used by rheumatologists for people that are having joint pain, rheumatological conditions. It's called hydroxychloroquine. And interestingly, you may have heard about reports, online of doctors that have found that treating COVID patients with hydroxychloroquine has been very, very helpful. So these are, I've heard myriad of anecdotes of physicians on the front lines, even in the ICUs, that have been treating severely ill SARS-CoV-2 patients with hydroxychloroquine. So I thought, mainly for her rheumatological condition, but also because she had Babesia, I would put her on hydroxychloroquine. And sure enough, that took care of the rest of the inflammation. So now, she's not 100% out of the woods. I'd say she's about 90% better. She's no longer sleeping in the recliner chair. She's back in bed. Her anxiety has diminished. And we've been able to kind of gradually take different treatments away, and she's holding her own, and she's really coming back to the person that I used to know, and super grateful. Now, I would encourage people that have post-COVID syndrome, or that are in this group of long haulers, to really ask your doctor to think outside of the box. And then I would encourage the doctors that are caring for these patients to consider the remote possibility that in some of these patients, it's not post-COVID, but they might still have a very low-grade SARS-CoV-2 infection. And we still need to be pursuing therapeutic agents for that.